some skills in Chapter 7, which I think would be important in obtaining staffing, would be good communication, flexibility, and strategic planning. I want to comment and say that I think staffing is not just about obtaining staff, but also maintaining the current staff you have and ensuring that you don't have a high turnover. I think planning is the most important skill that you can possess when it comes to staffing. You need to plan short term as well as long term for any changes in acuity, the population in the area, or just the type of patients that you're receiving. So that's pretty much has to do with short term planning. And any long-term planning and changes in the organizational structure, anything like that, that needs to go into and be taken into consideration when maintaining adequate nurse-to-patient ratios. When taking the leadership quiz, I scored highest on administration skills. It showed that I was detail-oriented, that I was strong at filling out paperwork, managing people, managing resources, obtaining resources, and responding to any concerns or requests. I feel like I do that really great as a charge nurse at night. We have limited resources that we have access to and limited personnel. We often have to play go-between between the charge nurse on the other floor, the operations administrator, and environmental services to make sure that the other nurses who are providing direct patient care have the resources that they need, and we often have to help them improvise if we can't obtain those resources to make sure that the patient care is being completed in a timely manner. I think maintaining flexibility with scheduling and communicating with current and future staff about their needs is also key in ensuring that they have adequate resources. And I think that if I utilize the literature to help me as a manager, it would help educate me as a manager, but it would also help ensure that the staff on the floor was using the most recent evidence-based practice skills. The article that I read on transdisciplinary nursing compared the healthcare team to a sports team. It stated that every player needs to make sure they know their role and that they have trust in the other team members to know that they can and do function well within their role. They also need to practice with each other frequently so that each player is allowed to operate and assisted in operating at their best level and that the most positive outcomes, and in this case for our patients, are achieved. It helps allow for multiple different disciplines to maintain these heavier patients that we're getting with multiple comorbidities, and allows for the patients to obtain more quality education and also leads for stronger and better outcomes for our patients. So I think that transdisciplinary nursing is definitely key to current nursing practice and is utilized in things like interdisciplinary rounds and things of that sort. Currently, I work in an organization with a vertical tiered structure, and within just our unit, it's the staff members and then the charge nurses, the team lead, and then the nurse manager. I am not really a huge fan of a vertical structure. Currently, I am head of the UPC committee on our floor, and we're enacting a lot of change and coming up with some policy changes to increase patient and staff satisfaction. And having a vertical structure, you have to go through multiple tiers, and each tier has to approve your idea, and so it can take a really long time. Within a horizontal structure, I think that's better because as a nurse, you need to be able to function with your upper management and nursing assistants, but also you need to communicate with other units and disciplines. And I think that a horizontal structure and having kind of one-on-one time with upper management and having them more present on the floor allows for more efficient and adequate patient care and ensures that staff is properly trained and oriented. The model that I can most align myself with is team nursing. It promotes teamwork and ensures that all nurses have a balance assignment and less burnout. And it allows for a more mix of expertise within the unit, which I think is really key in ensuring adequate patient care. You need the newer nurses to bring in the new evidence-based practice that they learn about in nursing school, but you also need the older nurses who have the experience in patient care and know what works and what necessarily doesn't. So that concludes my video blog for today, and I'm looking forward to seeing the rest of yours.